As you are at the playground with your 3-year-old girl, you see a child coming towards you. As the child comes closer, you notice that it appears to be a little girl with a small face, large head, hinged nose, and no hair, slightly resembling an elderly adult. How would you react? People of all ages react the same way when they see a child with Hutchinson-Gilford progeria syndrome. They stare, whisper, and some may even cry at their striking appearance. Unfortunately, children with progeria react to those stares and whispers like any normal child would. They are confused, scared, and alone. Hutchinson-Gilford progeria syndrome, or progeria for short, is a rare, fatal genetic disorder that causes a child to age rapidly. In 1886 to 1887, progeria was first diagnosed in England by Dr. Jonathan Hutchinson and Dr. Hastings Gilford. According to Medical News Today, 90% of children who have progeria have a mutation on the gene that encodes lamin a protein that holds the nucleus of the cell together. It is believed that this defect in lamin A protein makes the nucleus unstable, which seems to lead to the process of premature aging in progeria patients. Unfortunately, the lamin A mutation that causes progeria is without a cause. Progeria is not hereditary, and the chances of a baby born with progeria is 1 in every 4 to 8 million newborns. Progeria is hard to detect because the signs and symptoms don't start to appear until the child is between 10 to 24 months. I will now be illustrating the progression of progeria. Age from newborn, 2 months, 24 months, 2 years, and 4 years. This shows how rapidly progeria is. Even with the different ethnic backgrounds, the appearance of progeria is very similar in every child who has it. American Pregnancy Association states that if a child is born with progeria, they will experience growth failure, loss of body fat and hair, their skin will look aged, stiffness in joints, hip dislocation, generalized atherosclerosis, and cardiovascular disease and stroke. They also have the same facial features, which is a small face with a large head. Children with progeria usually have a lifespan between 8 and 21 years, but in most cases die at the age of 13. Usually, this is caused by a heart attack. Although there is currently no cure for progeria, scientists and parents have found treatments that have suppressed the rapid aging and the pain. Each parent may take extra steps to ease the pain a child feels when they have progeria. Haley Okins, a child who suffers from progeria, takes daily vitamins and therapy to ease her pain. According to her personal website at haleysPage.com, she usually takes Procal, vitamin E, and aspirin, along with hydrotherapy. Some parents take their children to a chiropractor to help with the pain in their child's back and joints. Another way to help a child with progeria is to use a drug called FTLS. According to the Progeria Research Foundation, FTLS was originally developed for cancer, but after testing it on mice with progeria-like symptoms, this drug has improved the signs of progeria. Hutchinson-Gilford progeria syndrome is a rare and fatal childhood disorder that causes a child to age rapidly. This is caused by a mutation in the gene lamin A. This mutation causes a child to have striking appearance changes, such as a small face, large head, their skin will appear old, and no body fat or hair. This mutation also causes a lot of pain in progeria patients. They can experience stiffness of joints, heart disease, and hip dislocations. Unfortunately, progeria does not have a cure, but there are ways to prevent the pain. Some patients take vitamins or take FTLS, which can improve the appearance of aging. So what would you do if a child with progeria comes up to you? After listening to this speech on progeria and becoming more aware of what this condition is, I would hope you would not stare or whisper, but smile.